continue to admit. Everybody got that we are recording this. There'll be a few other people I'm sure that will be joining, and we'll continue to let them in. But I'm Rhonda Erpelding, and I am one of the co-sector leads here for the Early Childhood Committee, working jointly with Lori Lanter. We want to welcome you to the Early Childhood Special Event. This takes the place of the regular Early Childhood Sector meeting. We do appreciate you taking the time out of your day to join us, and we're really excited to have Dr. Erik Willis from the University of North Carolina and the GO NAPSACC program here with us as our guest speaker. Our agenda that you'll see on the PowerPoint for today will include our speaker, followed by an opportunity to talk in smaller groups about next steps for the early childhood sector and how we can work together to promote the KCPA plan strategies in early care and education settings. Before we get started, I wanted to share a few housekeeping reminders. In the chat, please include your name so we know who is all with us this morning. We ask that you please mute yourself during the presentation to avoid any echoes and background noise. And you may want to consider changing your view to presenter view so you can see the person speaking along with the slides. We will have the presentation available both as slides and as a recording. And we just got notified that we are recording this presentation. Closed caption is a new option that is available to all participants. You may need to select that option to be enabled if you want it to be available. So I'm going to go ahead and present Dr. Erik Willis. Dr. Erik Willis is a research scientist and a lead data analyst for the GO NAPSACC project in the Center for Health Promotion and Disease Prevention, as well as an adjunct assistant professor in the Department of Nutrition at UNC Gillings School of Global Public Health. Erik holds a doctorate degree in exercise physiology from the University of Kansas and a Master of Public Health in Epidemiology and Biostatistics from Yale University. Prior to joining UNC, he completed his postdoctoral training in the Cancer Prevention Fellowship Program at the National Cancer Institute. His research interests include both public health and clinical approaches to understanding the beneficial effects of physical activity, weight loss, and decreasing sedentary time on a variety of health outcomes in both children and adults. We are excited to have Dr. Willis here to share more about the history and updates for GO NAPSACC. Dr. Willis, I'll hand it over to you.
All right, thank you. I will share my screen and get set up here. Okay, I'm seeing the full slides. Everyone's seeing this? Okay, cool. All right, so today I want to talk a little bit about the past, the present, and how what we're doing now can be associated with what you guys are doing in the KCPA plan, and then a little bit about the future and what we're doing to enhance GO NAPSACC moving forward, and how all that is associated with strategies to increase physical activity, as well as our other modules in GO NAPSACC. So our history, we'll start out with a little bit of the background. A lot of you may already know the history. Some of you might not, or maybe need a refresher a little bit about where we've been. But the first 6 years of GO NAPSACC was really the creation of this at UNC, and it was actually a partnership between the School of Public Health, the Center of Health Promotion, Disease Prevention, and the Department of Public Health in North Carolina. It wasn't developed as a curriculum or an education materials. It was a planning model for child care providers to tailor what their needs are for specifically the first two modules developed, which was physical activity and child nutrition. During those 6 years, through pilot projects, there was over a dozen publications proving that this was effective in changing the environment of childcare. That was the point of the original GO NAPSACC creation. In 2008 to 2010, this is when GO NAPSACC really started to expand. If you look at the adoption in red, this is the paper and pencil original program that was disseminated through the United States in over 30 states. Those are in the red there in that program. It's also been adapted for use in the United Kingdom, so it is international as well. We consult on projects with them as well as expanding our work overseas. But it was, the promotion has been shown to be effective and evidence-based from the Excellence in Training Research Translation, the White House report, and more recently, we have been identified as the best evidence-based program for early childhood obesity risk compared to other programs available for the same age group. In 2014, we took the paper and pencil. This is before my time. I'll have to say I've only been able to be on the team for the past 3 years. So a lot of this work, I have to credit everyone before me to get to this point to where we are today. So in 2014, it was the launch to move GO NAPSACC online and pilot the online program to make sure that it is usable and feasible in the online format. So the objective was to create a model to provide driven consultant support for an online toolkit. We still wanted to make sure everything was evidence-based and user-friendly. And during this time, we actually expanded from our original 2 modules of physical activity and nutrition to 7 modules. So now the core components shown here on the right go from child nutrition to physical activity. Those were translated over to the online format, but also breastfeeding and infant feeding, farm to ECE, oral health, outdoor play and learning, and screen time. All of this is set up in the toolkit to go around our 5-step improvement process, which is to take our self-assessment around the best practices, create an action plan and goals that the providers want to work on to improve, take action. We provide tips and resources, and I'll go through all this in much more detail throughout my presentation. Learn more. We launched trainings in the past 1.5 years, and also keep it up. So this is a cycle on purpose, as we don't want them to just go through the process one time and end. It is to continue, reassess, and start the process over. If you're interested in a new module, you move over and start one of the other content areas. So it is a cycle that we like to promote in GO NAPSACC. The top of this image here is the welcome page on our website. So gonapsac.org, you come in and this is the first site you see. Currently, we have 3 user types. So we have our administrative user. Those are the state regional partners that managing the GO NAPSACC implementation in your state. We have our TA consultant user, and they provide the TA and guide the child care providers through the 5-step process. And of course, the provider user, which is the center directors or family child care home providers that are actually working through these topic areas in the 5-step process. So this is what the administrator's tools look like. They have access to registration codes to send out to TAs and providers within your state. They have access to the TA activity log, reports on providers, and anything that they're logging. All of that is managed within our dashboard for the administrator to have access to within each state. The consultant tools provide access to connect to child care programs that they're working with. They can see their process and progress through the 5-step process. They're able to have their own resources for themselves to learn in the different topic areas, as well as the providers to supply them with materials to help them move through all the content areas. And all of this can be monitored by the individual program that they're working on right through the dashboard, or through reporting. They can download specific reports and look at more aggregate overall programs that they're working on in bigger groups. And again, the administrator has access to the whole state, so they can look at everyone if they wanted to through the dashboard. That's all available through these 2 user types. The third user is the provider user, and this is where they can go in and take their self-assessments, create their action plans, go through the tips and materials. They have access to all the trainings and reassess these, and they can monitor all their progress in our dashboard. And this is just a snapshot of what the providers see when they log in to GO NAPSACC. So all of this is collecting this information in our database. So we have data sets to look at provider level best practices available to the administrators and the TAs. It captures the assessment data on all 7 of our modules, pre-post comparisons if we're getting programs through the 5-step process, the characteristics of those programs. And this can be able to be used by your state to compare within different regions, different pilot studies, different initiatives that you want to use. That data is all being collected within our dashboard, and it's all available to you as users of our platform. So currently the reach of GO NAPSACC, since we've launched to the online format, is we're currently contracted with 21 states. We are reaching over 8,000 programs registered in our website, and they report how many children are enrolled in their programs. We're close to 400,000 children enrolled in those 8,000 programs currently active. We were interested in how states are integrating and implementing our program. It's all done differently in every state. And we wanted to show the variability of how this is being done across all of our GO NAPSACC programs. So we actually partnered with the CDC this past year, and we did a paper that is currently in press. It was accepted for publication in Health Promotion and Practice. And it really looked at how GO NAPSACC is being integrated into state systems, and it shows all the different ways that it's doing it. The most popular way states are integrating GO NAPSACC into systems work is approving our trainings for professional development credit or contact hours. That's the main way. But there are also states implementing the best practices and the self-assessments into their recognition programs or their quality rating and improvement systems. Some are using trainings in replace of college credit or college course materials. So doing our trainings instead of some more asynchronous lecture type trainings. And some states aren't integrating it into states at all. But on average, there's usually 2 or more of these things going on simultaneously. It's never just one way that it's being integrated into the state system. Once you work with a GO NAPSACC implementation advisor, we build a plan that fits what your state needs and what your goals are. For most states, that is finding a way to make GO NAPSACC available statewide to all programs that are available. That's 70% of our states are doing that. But 23% are focusing more on regional pilots or studies or initiatives, just focusing on a small group to start. So there's different ways of how it's being rolled out once you are enrolled into a contract with us to do GO NAPSACC. The other thing that's important is that technical assistance that's being provided to the programs, and there's a variety of states are using different resources in that as well. Again, on average, they're using about 2, but up to 4 different types of resources and types of consultants to actually deliver GO NAPSACC to the providers. So there's a lot of different ways, and the variation of how this is going can be tailored to the needs of the state. What others and some of our own work has shown is the barriers to actually implementing GO NAPSACC within the state. Because we have such a variety of different types of TAs being used to implement GO NAPSACC, the experience may not always align with the content modules. They may not have the experience in physical activity specifically. That may not be their background, so they have trouble teaching those type of lessons to the providers. Motivation of the director, motivation of the staff to be taking on some additional tasks, state level funding or even program level funding to implement environmental changes or buying new equipment, turnover of management. And also it's hard, we can get providers to sign up for GO NAPSACC, take that first self-assessment. That seems to be something that we can get people on board to do. Completing a whole cycle actually is something that we struggle a little bit with, and I want to talk a little bit about that. That is an interest area of ours. In 2020, we actually did a database review of all of the programs registered in GO NAPSACC and their activity. And we were trying to see, just based on data, we already talked about the implementation strategies were different, but just based on the quantitative data that we had, could we identify predictors that would complete our process, that they're going through it just fine as is with how it's running currently? And can we create a risk score to identify them early enough to maybe we could focus resources and education and our time on those specific programs rather than everyone in a blanket type approach. And at the time, we had about 4,000 programs. You can see just in 2 years, our registered users, I showed you we have 8,000 programs now. They've doubled in 2 years registered on our website. But at the time of this report, we had about 4,000. We split it into our predictors and then our risk score validation. And what we actually ended up finding was there were 5 predictors that showed non-compliance with the 5-step process. So family child care homes seem to have a less likelihood of completing the 5-step process than, say, center-based cares or Head Starts. If they were not participating in CACFP programs, they were less likely to complete the process. Not creating an action plan, not setting those goals, that made them less likely. Now, any one of these things by themselves would predict that you are less likely, but the more of these that you check the box for, then you are really unlikely to participate. So it was able to give us a score based on these 5 components on where we thought you might struggle with completing Go NAPSACC. That was actually shown to be 91% accurate. So based on these 5 things, we felt pretty confident that we would be able to predict if you were going to complete Go NAPSACC right when you registered. We're still trying to figure out our next steps. We want to figure out this, maybe a readiness check. We're trying to see how we can actually start implementing this into the website. This information is available in a scientific publication, but it hasn't been integrated into Go NAPSACC as of right now. This paper just came out in 2022, so this year. So that's a little bit about the background of Go NAPSACC, how states are using it. What I really want to show you now is, luckily you guys have a very detailed activity plan, and it made it very easy for me to go through it and see all your goals and interests and strategies. And I can show you some of the things Go NAPSACC offers that might be able to help you reach your goals in each one of these strategies, specifically around your ECE work group. So when I was looking at your strategy 4, adopting standards of early childhood education settings, what I really just want to touch on is how Go NAPSACC builds their best practices. It is a lengthy process. So every time we take on a new module, we always start that with a literature review. So we go through we meet with a librarian at UNC, we comb through all the different literature databases around that topic area to really understand that evidence base and do a systematic review. We also, at the same time, are looking at state regulations, national guidelines, professional organization recommendations to make sure we're covering all of our bases. Once we have all that data gathered, we then look for experts in the field specifically around that topic area. So we're looking for other research teams that focus in this area, childcare programs to read our best practices, make sure that they're easy to understand, what we're asking them to do makes sense. And then we look for other national organizations nationwide to also read these best practices and give their feedback. And after a couple cycles through that, we're able to narrow down our best practices that are then turned into our self-assessments. When we look at the target areas of our self-assessments, caring for our children's high impact standards, our best practices do target 35 of the 47 best practices that they have listed. We've also crosswalked different states as initiatives with our best practices. So looking at Missouri's Move Smart childcare criteria, Go NAPSACC targets all 12 of the core and advanced level criteria in that initiative. We've also crosswalked Kansas City breastfeeding friendly designation criteria, and our breastfeeding infant feeding module does target all 5 of the areas that are recommended in there. So a lot of what we're getting does translate into initiatives that states are interested in and what they're saying is important in priority areas. All of that is captured within Go NAPSACC. This is just an example of the physical activity module. So we have best practice sections broken into 5 different groups. So time provided, the environment, teachers' practices, staff professional development, and written policies. And under each one of those is the best practices in those subheadings. And just some examples of best practices is that preschool children are provided 120 minutes or more of indoor or outdoor physical activity each day. Teachers incorporate physical activity into classroom routines, transitions, and planned activities. So for example, the total Go NAPSACC physical activity module has 23 best practices. Child nutrition has 46, screen time has 13. So they vary based on the evidence and what is being recommended. So there's more in some, less in others, but they're all covering as much topic area as we've gotten in that process of identifying best practices that I discussed. All of this is available in reports, so you can see the adoption of the best practices based on the dashboard and what's being captured by Go NAPSACC. We have the TA reports that could be downloaded by the administrators. You can look at self-assessment scores. The consultants can look at those. The administrator can look at those. All of those are downloaded and accessed with some filtering that you can apply right in our dashboard, looking at date ranges or specific self-assessments. All that is pulled down for you, accessed by anyone. The providers can see this. They look at their own. They don't have access to other programs. They can look at their own progress through the dashboard when they log in, but not look across programs like the upper level users can. One of the features that Go NAPSACC also has is the TA activity log. So TAs can actually use our platform to log what programs they're talking to, how long they talked to them, how they contacted them, what they're contacting them about, what module specifically, or any notes. All that is captured here. I will say that this is probably the least used feature on the Go NAPSACC website. A lot of TAs may already have somewhere where they're logging time or notes, and this might be redundant to them. Other places don't have that access, so they do use it. So this is not really a good, if you're getting a state report and you're looking at TA activity in your state, this may not be the most accurate measure of it because there might be just not, TAs are not using this feature, but it is there. What we can do now is those reports come down pretty raw in Excel files. And so if you have an evaluator in your state, they can use that data, clean it, and make sense of it. But a lot of states didn't have evaluators. So what we worked on in the past couple of years is creating a tool for each module so that TAs and administrators could download that report and actually process this data in just a click of a button. You copy and paste your raw data into this Excel sheet, and it summarizes everything for you. So up here in the top, some of it's cut off, but you can get overall in a bunch of programs when you download the file, the average best practices met, the total score, post scores, and change all from that. And this could be used if you're looking at areas that you want to focus on, say across modules, and you download, say physical activity, your programs that you're working with, they're 90% of them are already meeting best practices for physical activity. But in screen time, only 60% are. Maybe this is somewhere you want to focus your energy and your time on because it's scoring lower or figuring out why the interest in these other areas may be less. The other thing this does is actually scores individual practices for each of the modules. So if I'm looking at this right now and I look at, okay, programs in screen time, children 2 years of age and older are allowed 30 minutes of screen time or less each week. That's the best practice. Well, we have almost 90% of the programs meeting that best practice. That's probably not something I need to focus my time on. But I go down here, families being offered education materials 2 or more times a year. I only have 40% of my programs focusing on that. This can help you identify different best practices in areas where you might want to work on. So the data really could drive stakeholder discussions. We can, where do providers struggle? Like we just talked about, what goals are being completed most often, what's most popular, what's least popular. Maybe those are being fed by some sort of challenges in the system, funding, integration. It could be anything. These are areas that can start driving discussions on why, where, how are we going to address these, and what do we want to do. Maybe TAs aren't picking up on certain topic areas because maybe they're not comfortable in that topic area. These are all things you can kind of explore. And this data can be used to advocate for additional funding for initiatives that you may be interested in doing. And one example of that is actually Louisiana took the 2020, their annual report. Every state gets one report from us that I create, and I send to the state administrator based on their request. And what they looked at that report and they looked at all their scores, they saw outdoor play and learning and farm to ECE were the ones that were the most, or the two modules that had the most, they were struggling with the most. They have stakeholder meetings within their state, and one of their stakeholders happened to be the Department of Education of Louisiana. They had their own priority areas, and those were around child nutrition, CACFP report, outdoor play and learning, infant child physical activity. Because they had the data and the priorities overlapped, they actually decided to use some of that funding to fund an outdoor play and learning and physical activity module uptake for programs. So they provided a stipend and a grant opportunity for programs to do these two modules. We go down the line, because this connection was made, when American Rescue Plan activity funding came around, the Department of Education decided to make that money available to actually fund PALS training, which I heard we talked about a little bit before this call, and also the outdoor play and learning training modules. So they made this money available, and they knew to target that area because they had the data to support the weaknesses in those areas. So it's just one example of how a state took the report, and because of the stakeholders all at the table together, they were able to combine their interest and actually expand this and make this available to programs. So when we move on to, that was kind of, so in 4, those are the kind of areas I feel like adopting practices, how we get them, they are available, and there's ways to monitor and figure out how to work with them. But in strategy 5, focusing on professional development, what I want to highlight is in the past 18 months, we've actually launched our training library. And this is a total of 35 half-hour trainings. They're in every module based on the best practices available. This is obviously outdoor play and learning. We have 4 trainings in outdoor play and learning. Playtime, environment, policy, all of these are on there. There's handouts that go along with them. We track completion rates. You can download certificates if you are approved to have contact hour credits. This is all managed in our database. So again, we wanted to put out there how we developed, disseminated, and the first year of uptake of our training. So we actually have another paper that is coming out. It was accepted in Nutrition Education and Behavior about the GO NAPSACC trainings in our process. And what we used was our database review and a state level survey. And we had 20 of our 21 states respond to our survey about how they disseminated the trainings. But a little bit about the development. This was an iterative process. We, as a group at GO NAPSACC, created a plan. Someone led each of the trainings based on their expertise. We brought those back to group discussions. This kind of went back in a cycle for several meetings until we all agreed on what our plan was before we moved it forward into a script and slide development. A draft recording was then sent out to those external reviews. So we're following the same process we do with our best practices. Based on the feedback we get from the reviews, we started the cycle all over again until we made everyone on board that the trainings were the best they could possibly be for an on-demand recorded training. Finally, we were able to make the handouts and review the edits and make them available. So this cycle happened in all 35 trainings. So even though they launched a year and a half, we've been doing this. I think this was my first day in the office. We had the first meeting about this. So 3.5 years ago, we first started making these trainings, and now they're finally up there and people are using them. And it's really exciting to see all of the work, people using all that work that we put into it. What we looked at for the dissemination, the biggest, having the trainings approved for professional development credit was the most important motivating factor for programs to take our trainings. That's probably not surprising to anyone. There was a bit of an incentive to do it. Some of the barriers to get trainings approved for development credit was in states, the technical ability of our certification system, uploading that information and names into their state registries is actually kind of burdensome. So we've started to try to pilot ways that our GO NAPSACC database can talk directly to state training registries. This is an extra cost. It is kind of more complicated than you would think it would be. It's not just one thing that's going to work for all states. All those registries are different, but we're trying to find ways to streamline this so it goes right into the registry and programs get credit for taking the trainings. A lot of states, some states, I didn't say a lot, some states prohibited on-demand trainings. So we were able to find ways to prepare toolkits to have consultants facilitate these online trainings. Where they are live, they can use the videos as supplement to their class, and they can pause it at different places and have discussion. And that seemed to work well in several examples. We wanted to make the training short because most people don't want to sit around watching hours and hours of training online, but that also had a consequence of the contact hours not being enough to meet a certain threshold to be counted for contact hours. So we've actually created bundles of trainings that can be done together in packages that meet that threshold so that we can get these trainings approved for different states to do that. So by talking to states and understanding the barriers, go through the implementation of your state administrator, goes to our implementation advisor. We try to find ways to get this and work well in your state of how you need it to work. And it's different. Like I said, it's different in every state. So we try to be able to tailor that as needed. Our uptake of trainings in that first year, the trainings for on-demand, being on-demand and the asynchronous, having to listen to someone talk, they actually scored pretty well in our evaluations of being easy to follow. They thought they were engaging. They were able to apply what they learned. The types of programs doing these trainings, if you look over on the right-hand side, all 8,000 programs, this in the blue bar, that's how the distribution of programs are in GO NAPSACC. So most of our programs are center-based. Most of them are in metro areas, and most of them are, and a lot of 65% are CACFP participants logged into our database. But when we look at of those participants who were taking our trainings, we actually had a lot of family child care homes taking those trainings. A lot of people in rural areas, more than what's registered. A large proportion of those from rural areas were accessing our trainings. What was interesting is that the CACFP participants were actually taking our trainings more than the non-CACFP participants. So it'd be interesting why and how we could target those other participants to be interested in the trainings. So it's just a quick snapshot of what was happening in that first year and how we got there before they launched. And I kind of briefly touched on this a little bit earlier about how groups are implementing this into replacing coursework. But in the state of Indiana, they have a non-formal CDA initiative. And this initiative has 120 hours of instruction. And what they were able to do is actually take, instead of having 14 of those hours were able to be replaced with our on-demand training. So they didn't have to go into the coursework to do this. It could be done online. It actually was pretty successful. Indiana has then now started piloting our trainings into their bilingual associate's degree program. So it's going to take up some of their Ivy Tech community college credits. They can watch these trainings instead of some of the coursework. And they've actually, part of the goal of this bilingual degree is to improve the English speaking quality of the participants. And because now a lot of our stuff is translated into Spanish, while the trainings are in English, the handouts are in both English and Spanish. So you'll be able to watch the trainings in English, have the handout, but also see the written handout in Spanish to be able to try to bring everything together if there's any sticking points. This has led, Indiana has introduced us to the National CDA Agency, and in the last couple of weeks, we've started initial meetings with them to see how we can integrate this even more into this process. So we're always trying to find new ways to expand Go NAPSACC. The other thing to talk about a little bit is North Carolina, for the past 20 years, had an initiative called Be Active Kids. This was funded by Blue Cross Blue Shield of Kansas City, sorry, not Kansas City, North Carolina. I, at one point, was funded by Blue Cross Blue Shield of Kansas City when I was on my PhD work there. This is North Carolina's Blue Cross Blue Shield. So this program was done in person in North Carolina. And about 2.5 years ago, we actually merged together Go NAPSACC and Be Active Kids. So in that time, we have started to figure out how we can make the Be Active Kids available through Go NAPSACC. So what we've been building is a Train the Trainer module in our consultants resources page. This is going to be designed to train the TA consultants so they can go in and help providers feel more comfortable with motor skill opportunities and high quality physical activity. Makes the provider more comfortable teaching it so that they can go in and instruct the providers out there doing the work. The toolkit's going to contain videos, lesson plans, and the movement guide. That's all going to be integrated into our system. We probably within the next year and a half. This is being built currently. I think we just got the website, just went to the web developer to start planning the page. That's where we're at with this. So those are just some areas that we can cover for professional development. So for your promoting best practices, really, it's Go NAPSACC. You actually have Go NAPSACC listed in the strategy as one of your bullet points. A lot of the things I already talked about really fits under here. We have our evidence-based practices, the self-assessments. We're going to have the build the skills, train the trainer coming soon. We have all of our on-demand trainings. Our team is experienced working with state systems to implement and integrate into different system to like quality insurance improvement systems, development credit, contact hours. A lot of this stuff can really fit into this specific thing. The two things that I haven't really touched on a lot, even though I've mentioned it, is our tips and material library. All 7 modules have their own library broken down by the content area and best practices. So a lot of them are now available in Spanish. And inside of those, if you look over here, they're even broken down into resources and tips for staff and teachers, classroom activities, and family engagement. All of that is inside the dashboard and available. The consultant resources page, this was launched a few years ago to help guide consultants through the process of how to use Go NAPSACC. And as we've been talking about, there's a lot of new features that will be implemented in here. This is where Build the Skills is going to show up and just support documents for the TA who are working with the providers. One thing I'll just mention is an initiative that we just wrapped up called Better Together. This was our UNC Children's Healthy Weight Research Group and Nemours. It's a 3-year project, which turned into a 2-year project because we were down because of COVID for the whole first year and had to replan everything that we had planned originally to make it virtual. But this was implementing Nemours learning collaboratives with Go NAPSACC and bringing those things together and working with states to implement state level integration of these 2 resources. Why I bring this up is what's coming out of this project is actually the learning collaborative structure. So we have integrated Go NAPSACC Nemours learning collaboratives in 4 content areas: and infant, child, and nutrition, or child nutrition, infant, child, and physical activity, There's 8 hours of content and learning sessions, and then 6 hours for breastfeeding, infant feeding, and screen time. This is just the structure of how these modules will work. Oops, sorry. Things that come across both of these, everyone does. These sessions are about an hour each. So they're broken up so that you can be more flexible of how you use them. So there are going to be 8 hours for physical activity instruction to teach you how to do the learning collaborative. A whole toolkit will come with all the information that you need to run the learning collaborative for these programs. And then also screen time is a little bit shorter. It's mostly based on the content, what needs to be covered. You could do 8 1-hour sessions with providers, or you can do these learning collaboratives more broken up into maybe 4 2-hour sessions. It just depends on how you want to integrate that. But this is all going to be now available because of this Better Together initiative. So like I said, you have such a variety of how you can do learning collaboratives with programs. If you're interested in that, you can do one module and just focus on physical activity. You could do all 4 modules. It all is based on what your interests are. The materials are going to be done so that you can do it virtually or in person, 1 hour combined. All of this stuff is in there. So what it's really going to do is, because Go NAPSACC now is fully integrated, this learning collaborative moves programs through a full cycle, plus creates the community between programs and has the TA support leading it. What we actually found within each state, while we had our pilot going on, what we're calling a pilot, we also opened it up statewide. And our statewide programs, just like in our predictors paper, we had a hard time getting them through the 5-step program. We had almost 400 to 500 programs in the learning collaboratives across the states. We almost had 100% completion of the cycle of those taking the learning collaboratives. The compliance was so much higher, but it was also a lot more time and support coming into those programs to complete all these stages. So there's a little bit of trade-off. Okay. So the last piece, which is probably the one that we have the least amount of Go NAPSACC stuff available for, is the family engagement piece. One thing to highlight here would just be that there are family engagement sections in all the tips and materials. So there are some resources available through Go NAPSACC for family engagement. But coming back to the Better Together project that we just talked about, Arkansas actually did another pilot within the study about family cafes. And the point of these family cafes was to learn more information on a health topic and to connect families with other families across childcare programs. This was done, all of Better Together was done virtually and in person, depending on the time of COVID that we were in. So the first year of the program's all virtual, and as the restrictions were released, some states were able to do some in-person stuff. So these materials are adapted for both use. We had 33 programs participating in this. It integrated the HOPE structure out of Tufts University, as well as Go NAPSACC and the Moores. And there's a staff-only intro cafe, and then the rest of them topic-specific were open to staff and family. Each of them had about 60% families attend and 40% were staff. Family style dining and mindful eating, this is all being analyzed now. We're in the evaluation stage and looking at a lot of this stuff. We don't know. It had the least attendance, so maybe the interest was down. It was at the end of the project. People might just know that it was coming to an end and they didn't come. We don't really know, but it really trailed off at the end. And you would actually see that too in some of the evaluation results. But a cafe structure, they were run for about 90 minutes. You had an intro, you had some education at the beginning, intro to what a cafe was, how the guidelines were going to go for the conversations, and then 3 rounds of questions where families were broken up into little breakout groups, kind of like what you're going to do later on in this call, to talk about 3 content areas related to each of those, depending on what the topic was. So physical activity, they had breakout sessions for the physical activity. There would be some time for a reflection question for each participant to think about something related to the topic. What they actually had, what I thought was interesting, was there's a program that they could type a note to themselves that would automatically send to them in the future related to whatever they were discussing that day. I thought that was an interesting piece. And then some closing remarks. The evaluations were actually pretty high, and they kind of trail with, if you look at the attendance here, family activity, cooking, screen time, they were probably all in the 80s. Enjoyment, useful, ability to learn, apply what they learn. These 70s, 79, 70, 60, 32 net promoter score, that came from that last module. There was something about the family mealtime one that just wasn't connecting with participants, and that'll be interesting to tease out as we move forward. A net promoter score is just the likelihood that you would recommend these cafes versus the people who said that they wouldn't recommend the cafes. And they have a score grid I have at the bottom. So really anything over a 30 is actually pretty good on a net promoter score. And most of them scored excellent. And then we have just, the last cafe there, the family mealtime one being just above 30, but they were really well received with families in Arkansas. These toolkits are currently in development. I don't have a timeline of when they'll be. A lot of the focus has been making the toolkits for the learning collaborative. So these will also be available if people are interested in using a family cafe approach. We'll have a toolkit that you could use to guide you through that process. So that's really how Go NAPSACC, what it has available currently, how you might be able to use it, pieces that you might be interested in to help you with your initiative with the KCPA plan or other initiatives that you have. There's a lot of things going on. You don't do it all, do what you need, piece it together as you need it. But I do want to spend a little bit of time of talking about what's next and how we are continuing to expand Go NAPSACC and the work that we're doing in other areas. This stuff is going to be way down the line before it gets to what I was just talking about, ready to go and to implement. But we talked about how Go NAPSACC really focuses on the administrator, the TA consultant, and that director, that child care director program. We don't have a teacher user, so the director is really the only one that has access to our account. We are actually interested in the health behaviors of the provider, and we want to expand to have a teacher user built into our platform. So right now, this is how Go NAPSACC is really focusing on the environment to affect child health behaviors, physical activity, looking at the foods provided, the equipment, the environment, the education professional development related to the kids, and the child care as your job. But what we don't really have right now is the teacher is responsible for role modeling these behaviors and providing encouragement, and their own health behaviors are very important to this. There's a lot of research out there showing that the teacher's own knowledge and skills, diet, quality, and physical activity probably plays a role in the health of the children. So we're asking teachers in Go NAPSACC and all of our other programs to do a lot. Limit screen time, integrate time for play, role model, encouragement, manage disruptive. We're asking them to do all this stuff. And then when we talk to providers, they say, well, we don't have the education or training or resources to do some of these more specific topics. I'm not comfortable, or I don't have the capacity to model some of these physical activity things that you're asking me to do outside. They don't have access to programs. Their job doesn't provide them with health insurance to go enroll in health promotion programs, and their stress level is actually really, really high compared to the general population. I'm sorry, now I'm going to try. When I explain this image right, it's really interesting. When I mess it up, it confuses everyone. So I'm going to try to be slow and make sure that you understand what I'm trying to present here, because this is really what got this work pushed forward, was this actual figure here. So this is a family child care home study. It was a 9-month intervention that our director, Diane Ward, had funded several years ago. And we went back and looked at a secondary analysis of this study. And what we had the environment scores from direct observation. So we knew the eating environment. We had the self-report diet of the providers, and we knew what the kids were eating while they were at the center, because we were observing all the meals being provided. So on the y-axis, we have the change in child diet quality over the study, over 9 months. Then what we did was we classified those kids into groups based on the change in the environment score and the change in the provider's diet quality. So if we look at this orange line, over the 9 months, if the nutrition environment actually got worse and the provider diet quality got worse, we actually saw the child's diet quality go down by 6%. If we were able to change in the intervention, the environment score to go up, but the provider score still went down, we saw about a 3% increase in child diet quality. So we're going the right direction. If we improved the provider diet quality, but not the environment, we saw about a 5%. But when we were able to improve both, it was like a 13% increase in child diet quality when we were able to target all the levels of the child care center. So that was really interesting, and that really was our preliminary data. This wasn't designed to test this. So this isn't, there's a lot of limitations to this analysis. That's what I would say. I wouldn't go and take this and this is the end all be all of how this all works out. But what we were able to do was actually get this study funded to actually evaluate if improving health behaviors of the provider enhances GO NAPSACC, both the environment of GO NAPSACC and the child diet and physical activity. So over the next 5 years, the study just started in February. We're building the teacher user right now as we speak. We will enroll 84 child care centers in North Carolina, 168 classroom teachers, and 700 children to enroll in this study. Programs will either be randomized to just do GO NAPSACC as it currently is, or GO NAPSACC plus the teacher user account. So we'll actually be able to see if that addition of GO NAPSACC actually is doing above and beyond what GO NAPSACC does on its own. And then we'll follow up at 6 and 12 months of the program. So GO NAPSACC will be going on as it normally does, but providers can enroll in a healthy eating and physical activity program where they can either focus on a program around weight loss, if that's a goal of theirs, or just prevention of weight gain. And they'll get programming and education materials and scales and Fitbits to help motivate them based on what their interests and goals are. And we'll see how all that will work out. And we'll be able to capture the environment through our observation tools. We'll be collecting outcomes on the provider, and all 700 kids will get an accelerometer, which will be very fun trying to collect all that data. But this is really exciting to actually be able to design and test exactly what we want to do and see how all of this together works on the kid. So potential outcomes from this would be actually be able to answer if the provider actually does above and beyond what GO NAPSACC is already doing, but also at the same time, we're able to use this funding to build our teacher user account. So we're actually being able to do both of these things with this grant. And hopefully if everything works out as planned, it can be integrated in at the end of the project relatively easy. The other thing to bring up is module expansion. We're always looking at new topic areas. We talked about our 7 modules that we currently have. That whole process I talked about of literature reviews, expert reviews, all of that is being done for social emotional development module and motor development module. So in the future, these 2 modules will be integrated into GO NAPSACC as the 8th and 9th modules of the program. The other thing we're interested in is not only expanding GO NAPSACC for childcare, but can the framework be used in other settings? So can we take the same environmental program platform and use it in adult care settings? So we received funding recently from the Alzheimer's Association to work with stakeholders and consultants and experts in adult care, nursing homes, assisted living, daycares. How could this transfer over? Can we build this up? And this one's just going to focus on physical activity at first. We want to keep it very narrow to see if it can even be transferred, and get a few of these types of facilities to enroll and give us feedback on how the program would work in that area. So not only are we expanding GO NAPSACC as the childcare information and content, but we're trying to see if we can bring this to the other care facilities. So really after all of that and everything I said, I really just want you to take home these 3 things. We started out as an assessment tool, but it's way more than that now. We offer a lot of different things that you can utilize in very different ways to hopefully expand your work. Specifically, the physical activity plan, it's not a curriculum. It can be molded to fit what your organization needs at the time it needs it and what your focus areas are on. And we're continuously refining and expanding GO NAPSACC in all different types of ways, as I talked about. As each state does do GO NAPSACC slightly different, the best way to figure out how to use GO NAPSACC for your purposes is through your state leads. And they're both on this call, I believe, today. I think I said both their names. I met you a few times, but here's their contact information. I hope that's okay. I put it on there. And so that would be the best way to move forward. And they're in direct conversations with their implementation advisors, which is how all of this work gets done. It's a community of people working together to do all of this. This is our current team, but if I put on everyone's picture over the past 20 years who's worked on this, I'd have to have a whole nother 58 slides to probably do that. But this is everyone that we currently have working with us that helps us do this every day. And a lot of people you probably recognize as well. And I just want to say thank you for letting me come and talk today. And I'm happy to help in any way to move this work forward.
Great. Thank you so much, Dr. Willis. A lot of great information, a lot of great work that's been done, and more work to come. So thank you so much. This is a great opportunity that you guys can ask any questions to Dr. Willis. If you'd like to do that, please unmute yourself, or you can write your question in the chat.
We'll call out, I do see Rich on the call. He's one of the implementation advisors and the originator of the Be Active Kids program. So if he's can also maybe wrangle him into some
Excellent
questions as well.
It might be great to put the contacts in the chat again. Do it. Eric, you had those state contacts on your side. Lisa Farmer is one of them. Lisa Lauer. I always go back to Farmer. Sorry about that, Lisa. You want to put your information in the chat. So Lisa's on the Missouri side, and then I can't remember who was on the Kansas side.
Kelly.
Yeah, Shelly, folks can from the Kansas side, I just put in there, they can reach out to Kelly King-Swart or myself. Kelly's actually listed as the lead for GO NAPSACC for Kansas, but I can also help answer some questions.
Thank you.
Thanks, Chris.
Thank you, Shelley, for bringing that up. And thank you, Eric. That was a great presentation and a great overview. We do utilize the TA consultant model. So we have TA consultants because it just seems to work. Do you want to share any information on that? But we really feel like that is a boost for the ECE providers to have that consultant helping them through the modules.
Yeah, I mean, the consultants are, a lot of states use all those different consultants. We kind of showed you the very different ones, but the more support they have, I think it helps, especially what we saw in the learning collaboratives. The more of that TA support, when they walked them through a lot of things, we had almost 100% complete a full cycle, where our states that are maybe a little more hands-off with our predictor model, we see a little more struggling with that. So the more support we can get, and if we can figure out a way to target the support to those that need it the most, because there's only so much resources and so much of people's time, we're trying to figure out how to use it the most efficient way. And that's all things that we're trying to figure out as we think more about implementation and dissemination of GO NAPSACC.
Looks like we have a question in the chat room from Kyle Matchell from Mark. How can providers get involved in the Missouri program? Lisa, do you want to take that?
Yes, I will. I would love, they can reach out to me. My contact information was, I'll put that in again. They can just email me. Currently, we will be looking to add new providers in October with the TA consultant model. The cycle that they work through takes about 6 months, and we do we let the providers choose, but we are hoping that they will focus on right now child nutrition, physical activity, farm to ECE, one of those items. And it seems like once they get started in one area, then we also do have providers that will go ahead and begin working in other areas in conjunction, you know, on their own in conjunction with child nutrition, physical activity. So our TA consultants are in from Missouri Extension and Child Care Aware of Missouri, and then a few of the local public health, child care, health consultants as well.
Lisa, Lisa, are there incentives for programs to participate, or
We do have an incentive. So we have an incentive with Kaplan, educational learning, and as they go through each module that they complete, that's taking their, pre-assessment, going through the module, and then once they've completed their post-assessment and reached their goals, then they apply to, or just let us know, and they receive a $75 gift card with Kaplan that they can purchase materials to help enhance their program. And the $75, they can do that 2 times. So a total of $150 incentive.
is there an application for them to participate, or they just contact
No,
you?
they just need to contact me, and then I will put them in touch with a TA consultant in their area, or most of the, we found after COVID that most of the consultation takes place now virtually. So that was a good thing, because we could utilize TA consultants, from maybe the St. Louis area could be working with ECE providers in smaller areas of the state, or it works nicely.
Great, thank you.
So my question is for, it could be Eric, Chris, or for Lisa, really. So give me like 3 talking points. If I'm as I go out to childcare providers, what are 3 things for me to just this about Go NAPSACC? Like, what are the bottom line?
Good question. Tough one. I think the flexibility of it, I don't know, maybe Rich can type something in the chat too. He's working with states specifically. I don't know if there's something in your state specifically that you're offering that would be a motivating factor. If it's those whatever that incentive is to do some of these things, like if you are getting contact hours or something, maybe there's something you want to show how this is going to directly relate to their mission, their priorities, and what they're doing. So they want to buy into it and not just take the self-assessment and be, that's it. I want to see how I do. I'm going to go and do all 7 modules, self-assess myself, and never log in and see all of this other stuff that we have to offer. I think you got to get them on board, and knowing your state better probably would have, you guys might have better ideas than I would of how to sell it to your groups.
Well, within Kansas, as I mentioned, that our providers can access Go NAPSACC if they work within our L2Q, which is our QRAS system, and then our child care health consultant system. So within that, they first need to be part of either of those. On the L2Q side, they're specifically working on helping providers with their handbooks, with their policies. And so that's where Go NAPSACC comes in. In each of the modules, there's policies that are attached to the different modules. So that's kind of the groundwork for that. Along with, we have we've created a way to have the Go NAPSACC modules be able to be approved for clock hours through KDHE. So that is always a selling point to providers, that they can get those free KDHE hours. On the CCHC side, which is our child care health consultant network, again, they need to be working with a coach, a technical assistance provider or support system. But because that's exactly what the child care health system does, is a focus on health and safety, which is what all the Go NAPSACC modules are. So it just aligns perfectly with that system. And again, the draw is the KDHE hours, but then they recognize that there's all sorts of resources that can be at their fingertips with for themselves and for the families that they work with.
So Chris, with that health consultant network, they would be able to do the assessment piece of it and then tell that TA, I want to do the GO NAPSACC and that. could
Correct.
be,
They just need to,
what they
yeah,
do. Okay.
with either projects, they just,
Okay.
as they sign up or, register with either side. And you can, within Kansas, you can work with a CCHC consultant and you can work with an L2Q consultant. It's all provider driven. It's what the provider needs. So if they need to work on some of their policies, then they would work with our L2Q consultant. They want to work and they need to look at some health and safety. Maybe they've had some compliance issues with KDHEs. So they need to focus on that so they can work in tandem with both projects.
Thank you.
I think and it's probably also important that a lot of this stuff is already their interest in their priority areas, and this isn't extra work. You go in and tell someone you got to start doing something more, they always kind of push back a little bit. Even I don't want to do anything more, but this is already something that they need to be doing, and it's part of it. It just helps. You don't have to go create stuff from scratch. We've made so much stuff available that can just be as a starting point or be used. So I think it's helpful that it's not something more they have to put on their plate when they're already overwhelmed.
Great questions. Any last questions, comments? I'd love to hear them.
I'll ask something really quickly because I'm really interested in the study that you're starting, Eric, because it was quite interesting to see the change in when you change the environment and you change the providers' behaviors, the improvement in the quality of the child's diet. So this was all nutrition focused. I assume it sounded like you were sort of saying this, but I just wanted to confirm that the study that you're starting includes both the nutrition and physical activity environment and behaviors. Is that
Yeah.
right?
Yeah. So why our sample is so big is that we have two primary outcomes. We're looking at diet quality of the kids and physical activity measured by accelerometers. So it makes our sample twice as large as what we would have needed. So yeah, we're looking at both behaviors. Physical activity is a lot harder to change.
For providers or kids?
Just always. Providers. We've had several. We have a whole R01 just on physical activity promotion and providers that actually did not show any change. So we're taking a more intensive approach with this one. And a lot of what we learned from that original trial is being used in it. And it is why it's being mentioned more as a weight management focus, because what came out of that other intervention was the interest, at least in our North Carolina providers, which is the same pool we're doing in this study, was that managing their weight, whether that is prevention of weight gain or weight loss, came up in all of our focus groups as their primary motivator for signing up into our physical activity intervention in the first place. But it was never intended to do that. So a lot of people got discouraged with it. So we're trying to come in as a different way to maybe they'll be more motivated in this because it aligns more with what they were wanting. And then we can look, even though the behaviors are what we are most interested in changing, if it's packaged under this weight management umbrella, maybe we can get them more interested. Just a lot we don't know yet. It'll be interesting. We start recruiting our first cohort in February. So it is a 5-year study. It'll be a while before we figure out anything, but
yeah. Well, this is sort of a random comment related to that, but have you ever thought instead of talking about it from a weight loss perspective, a weight maintenance perspective? So if you look at the increase, the number of pounds that people generally gain over time, if you simply maintained your weight versus gaining, it's a benefit.
So it is a weight, it's not going in as a weight loss program. It is a weight management program. So when they first come in, they'll take their own self-assessment just like you do now, and they will select if their interest is in maintaining their weight or weight loss. So there's actually 2 interventions nested within there, so they get to choose which one they actually want to do. But for us, a lot are interested in weight loss. Our childcare provider population happens to be 88% with overweight or obesity. So a lot of them, the weight loss is the interest that was the highest but maybe not everyone wants. I mean, yeah. So we want to give them the autonomy to choose what they're getting.
Any last questions or comments?
I do have a couple more, if you don't mind, but,
Great.
so Eric, I'm really interested in the demographics for the Better Together Family Cafe. I'm not sure if I missed them or not, but you know, this went on in Arkansas, and I didn't know if you could share
Yeah.
anything related to the demographics of the population that.
I don't have anything yet. All of that stuff is still, we're evaluating it now. The project just ended a few weeks ago, and we're starting at the top and working our way down. And the cafe was, a third or fourth nested project within it, and I don't have a whole lot of information yet on the numbers. But yeah, I just know that there were 33 programs, and we needed the evaluation results. So that's kind of all we have currently, but hopefully more. We're starting to think about how we want to get that information out, but it's just going to take a little bit of time.
Well, that will be very interesting information for this group when we think about it in relation to the 7th strategy of our PA plan. So it's the 4th one related to early childhood, but it's about family engagement. And so if that's a model that seems to be effective related to family engagement, it'd be really interesting for us to consider, what does that mean for this group? And the last question I'll ask before we transition over is really related to us from weighing in. How can we as an organization support early care and education providers on both sides? And I'm thinking about it from a data perspective. So you were talking about access to the information in GO NAPSACC, so on both sides, and that the states can request reports. How can we help identify where gaps might be and support that on both sides of or either side of the state line, especially as it relates to physical activity, screen time, even nutrition?
My recommendation is to go through each state lead. I think that you guys working together as a group, figuring out how you want to do that. All the data is all there. Like we said, Missouri doesn't have access to Kansas. Kansas doesn't have access to Missouri, but you guys are in an interesting place because you need to split two states. So it's something we haven't done before. Yeah, I think it's going to be an internal conversation with you guys of how you want to handle that.
I was going to chime in on that because I think that's a great, Shelley, thank you for bringing that up. I think that is a fantastic question. And I was going to see, Eric, I think you answered my question was going to be, have you had that come up? Have any other states done anything like that worked? I think that's a great.
The request can come in however you guys want. So I have access to all of it when I do your annual report, and you each get 2. So Kansas gets 2 groups of analysis and Missouri gets 2 groups of analysis. If you guys want to joint request one of those reports to be a certain region that crosses both state lines, I can do that, but I can't add more state reports because I'm already doing 2 for each state. So it's 44 reports that come in, and they all come in at the same time. I just got all of them right now. So I think it can be done. It's we got to figure out how we want to do it. The other way would be is the tools that we have. There's not a really good solution. It would be Missouri downloading their report out of the database and Kansas downloading report, and then you combine them using those Excel tools yourselves. But I think there's definitely 4 or 5 different ways we can do it. We just probably have to think and talk about the most efficient way. I just don't want to promise I can do another report with a group, everyone on the call that can hold me accountable for it when I don't know if I can.
That's right, you're being recorded.
Yeah.
Robin has a question.
Yeah, thanks. And I guess you kind of answered it. And so, so we have, I don't know if you've seen this, Eric, or if others on the call have. We did a regional physical activity report card using all local data to assign letter grades for various physical activity metrics. And so I think that there's a lot of interest in more data specific to regions, the Kansas City region, than just states as a whole. So I'm glad there's discussions about how we might be able to get something like that happening. And someone from weighing in, of course, would love to be involved in those conversations in terms of what that report might look like, and would be happy to assist however we can. So that's just I guess a question that you kind of already answered. And then just one general comment that I'd like to make, for, I guess, two general comments. One for this group. This is the very first sector specific special meeting that we're having between now and September 29th. September 29th is the Kansas City Physical Activity Summit. So Katie's gonna throw in the link, the registration for that September 29th summit. I hope everyone can join us. It's a virtual summit, so hopefully everyone from this group can join us. And just in terms of this group kicking off the series of events that we're having between now and then, this has been organized just in an excellent way. So kudos to everyone involved for joining the meeting. I know there's going to be great discussion that happens after in the next 45 minutes or so. So thanks to everybody for joining and participating, and big thanks to Dr. Willis. If you don't know this, you can probably tell Dr. Willis is like a huge rising star in the area of physical activity research in the United States. And we are beyond ecstatic that he agreed to present to our local group. So thanks to all, thanks to Dr. Willis.
Yeah, thanks, Robin. Just a quick caveat about the data thing. That is only going to be as good as what's in the database. So if you don't have programs in your region in our database, we're not going to be able to give you the report on it. So it is limited based on that. So the quality of the data is only as good as the data we have. So there may not be reports, but I really appreciate it. I think there was one more question. Someone had their hand up, but I just wanted to say that.
Yeah. Thank you. I believe, yes. Is it Mike?
Yeah, I was just going to say again, thank you, Dr. Willis. Very helpful. And I want to go back to something that Shelley touched on briefly about parent engagement. We are a program provider, physical activity program provider. We put kids on bikes, and we have seen this amazing connection between getting kids on bikes in the, like, balance bikes, pedal, and through some ECE programming and some learn to pedal classes. And we do not offer anything for parents, but we're seeing a request for parents to learn to ride or want to ride with their kids through the kids' activity with these site-based programming. And so to me, that was an unexpected outcome of now families riding together, parents that maybe didn't ride before, or they didn't think that riding was for them or biking was for them. And so I think there's something there. And there's a lot of what we call bike curious families that just didn't know first steps, and biking wasn't something they did, and it wasn't something their kids did, but because they had exposure to it in a program. It's been really interesting. And I think that there's more to that. So I'm going to be following you for many reasons, Dr. Willis. But I really think that there's something there from a parent engagement standpoint. So I found that completely interesting that Shelley brought that up.
Yeah, I'm actually very interested in what you said because I volunteer for Bike Durham in North Carolina, which is a bike advocacy group, and trying to figure out how to merge my work and that together is almost exactly what you said you were doing. So I'm actually very interested in how you guys are doing that.
I'll send you a note.
Yeah, thanks.
But yeah, you're welcome. But I think the parent engagement is a huge missing piece, because it needs to be reflected. Like the kids are practicing these things and practicing and learning these behaviors in the daytime, and it helps when that's mimicked or supported at home. That's all.
Great. Thank you so much for the comments and the questions. We are going to go ahead and do a stretch break. I thought this would probably be a good time to do this before we move into our breakout groups. So feel free to shut your camera off if you'd like to do that. It's up to you, but I would ask that you stand up, and if your abilities don't allow you to do that in a comfortable manner, then please go ahead and sit in your chair. That's okay, but we're going to go ahead and do a stretch break. Okay. So many of you probably over the summer have gone on a vacation, or maybe you have an upcoming vacation. So I thought this was pretty ideal as we are wrapping up the month of August. But I'm going to have everybody, as you stand up or you stand up tall in your chair, go ahead and stretch upward with your arms. About 5 seconds here. And then roll your head as you put your arms down from side to side, from the right to the left. We're warming up here. Put your hands on your hips and bend to the right and bend to the left. And return to the center with your hands on your hip. With your right hand still on your hip, you are going to use your elbow to write the name of a place you would like to take a vacation. So think of that place, whether it's hot, whether it's cold, and spell out the place with your right elbow of where you would like to go. Come back to the center after you have done that activity, spelling out the name of the place that you'd like to go. Now, with your left hand still on your hip, use the elbow again on the left side to write the name of the person you would like to go on that vacation with. And maybe it's one person, maybe it's your husband, your wife, your children, or your dog. Go through and write their name. And you might have a long list. Maybe you're taking a family reunion trip. So you want to go through and write all of those names out. And then last, come back to the middle. Stretch both your arms up in the sky and take turns reaching up to grab that money that you're going to need in the time, your PTO that you're going to need to take that vacation. And then come back to the middle, and you're welcome to sit down. We are now going to get ready to move into our breakout rooms. And we have a list of 5 questions that we'll be discussing in each breakout room.
All right, everyone. So you should be getting an invite quick. So just accept.
Do you need the Go NAPSACC people to join one of these?
I assigned them.
I
So
don't know if you need Rich and I to do anything else, or
do you want me to assign you to a group, Dr. Willis?
it doesn't matter to me. I don't know if I'll be any help. But if you want, we could both hop off if you don't need us anymore.
Okay. Just gonna put something in the chat. Okay. I will assign you to. Veronica, I can assign you to room 2. Did you get the invite?
I didn't get the invitation. I have the breakout room option here though. I can go on to.
Okay, so yeah, I didn't put Katie on one. Yeah.
Okay, I'll go on the other one.
All right, thank you.
Okay, sorry. How do I
No
join? There we go. Join
Yeah,
your room. Yes.
Our group. And now we're going to find out. So we're going to share a little bit of the highlights from the conversations that you had in your breakout rooms. So Rhonda, do you want to speak to that, or do you have a representative that you want to have from your group to share a summary of your conversations through that?
Sure, I'll go ahead and do that. So in our breakout group, we identified some current programs that are already going on in both Missouri and in Kansas, such as the Missouri recognition program, having resources, physical activity resources that providers can order, the GO NAPSACC, also the work with NMORS that's going on. And we also talked about a little bit of around barriers, and those barriers we identified sometimes is just the comfortability of the providers, lack of indoor space when weather is not permitting to take children outside. We also talked a little bit about some of the best practices and looking at best practices of having structured and unstructured play. Also limiting screen time, looking at the use of music and movement, and really embedding the physical activity importance throughout the whole environment. We also talked a little bit about family engagement, utilizing a newsletter by sharing examples of physical activities that families can do at home. Also utilizing the family cafes, which have been really successful in quality initiatives. And then I think that kind of summarizes professional development opportunities. I think that it really resonated with a lot of people that sometimes we focus a lot on nutrition, and there seems to be somewhat of a gap around professional development opportunities. So if we could take a look at those opportunities that we could embed into the EduCare program that Mark implements with 80 programs. We could, make some differences there around professional development. So having those opportunities to be approved for clock hours and then ongoing training around physical activity would be ideal. If I missed anything from our group, please feel free to add.
All right, thanks for sharing that summary, Rhonda. I'll go ahead and speak to our group as to what we discussed. We have a very large variety of things that we are doing to ensure physical activity within our own organizations. And we did discuss in depth the barriers to that, and that sometimes financial is part of that, especially because most of our organizations are not directly working with the children. We're in supporting roles. So that is something. When we talked about best practices, we talked a lot about integrating those into the activities that they're already doing. We talked about the portions of that does need to be teacher-led and not just the time or opportunity for them to have some free play or playtime. That Erik did share with us that some of the data is showing that even when given the opportunity, unless they know how to or are able to access the resources within their own environment, then they're not necessarily going to take that initiative on their own and get out there and move their bodies. So part of that should be teacher-led, and then just offering a variety of types of things for them to do and switching it up so that it's not the same all the time. We're parts of that best practices. And engaging with families. As far as, once again, some of us didn't have that direct family connection, but providing support. Amy and her role often provides support to providers who are doing that family engagement piece, who are actively using the family cafes and those types of ways of sharing resources. And then Shelley brought up a fantastic point that we do have access to the early childhood toolkit that has that family engagement piece to it. So I think she said we were going to make sure to add that when we send out the newsletter this go round, just as a reminder to everybody that oh, she's already on it. See that? Ask and you shall receive. We didn't get into, we talked too much, didn't get into the professional development piece of the discussion. But I know I would say the same thing as you guys were saying, and that one barrier to that is our by state representation on that, getting those pieces or those classes and trainings so that they meet the needs of both states for clock hours. So that somebody from our group, if there's anything that you really think that I missed and should have included, please feel free to hop on and share that. All right, well, we have done a lot in the last since 9 o'clock. So thank you, everybody. We do want to share the upcoming sector meetings. That is the fourth Thursday of each month. The next one will be September 22nd, which will be shortly before the KCPA Summit. If you have not already registered for that summit, it's going to be very informative, great time. I know that Robin had spoke that this is the first of the sector meetings leading up to that summit, and this information will be highlighted and a piece of that within that summit. So your work today is building foundation for things that we will be using later on, as it should be, right? So please do that. And then I have a note here, Shelley, help me out for open position. I don't know what that note means on our
Evelyn.
agenda.
Evelyn,
Oh,
go ahead. and
we're not
advance
letting
the slide.
Evelyn leave, so whatever.
So first, yeah, we'll invite you to join us at the summit. If you haven't already done so, we try to make it easy. Just scan that QR code and the registration should pop up for you. We hope that many of you can join us. It's open to anyone. Feel free to share the information with anyone you think might be interested. It will be virtual, so people across the states or across the country are welcome to participate. And the next one, Evelyn, is, open position. So first of all, let me just say this QR code is to complete an evaluation for today's meeting. Thank you all again for joining us. Like Lori said, we did accomplish a lot in 2 hours this morning already. Big thanks to Dr. Willis for presenting an update on Go NAPSACC. You all probably have more experience with it than I do, but it was very informative for me. So please do fill out the evaluation for us. And as a reminder, the open position is we still have an open position within the weighing in team. So if anyone is interested in being a part of that team, please reach out to us. I actually did not get that link put together for today's meeting, but can certainly share it to anyone who might be interested or knows of someone who is interested. So with that, we're a little past 11 o'clock. Again, thank you all for joining us this morning. This was our first, as Robin said, first of 6 special events we're hosting between now and September 29th. We welcome you to be engaged in any of them. And thank you for your active participation today to help inform our next steps with the early childhood sector. So with that, great to see you. Have a great rest of your week.
Thank you all.